To South Dakota now, where a huge healthcare system is hosting a gender identity summit. It's the third time Sanford Health has done this, but this comes at a time its critics are worried it could limit access to certain types of care, from gender affirming to abortions, if it merges with Fairview Health Services. That move itself also being criticized. Jennifer Hoff has more on what happens next.
Today, the University of Minnesota.
News broke this week the University of Minnesota plans to build a new billion-dollar hospital and wants to buy back its other medical facilities from Fairview Health Services after Fairview and Sanford Health announced plans to merge this year.
The way the evening is going to work.
But the mega merger drew concerns Tuesday at a public hearing from doctors, union members, and Phil Duran, a lawyer at Rainbow Health that advocates for gender-affirming care that includes therapy, medications, and surgery for people diagnosed with gender dysphoria.
Fairview has been quite adamant that its care policies will not change if this merger happens. So is that enough for you?
We appreciate that commitment, but there still seems to be rather a distance between Sanford and Fairview when it comes to this, and I don't think anything came out at the meeting Tuesday night that changed our concern about that.
Founded more than 100 years ago, Sanford is based in Sioux Falls, South Dakota, known for serving rural populations. Already operating about 20 hospitals, though, in Minnesota, the merger would more than double that. The two systems also rooted in the Lutheran Church.
Fairview articulates its mission and vision in purely secular terms right now, whereas one of the speakers pointed out that Sanford's mission and vision statement mentions God twice and patients no times. And so, what does that say? I don't know. What we do see is that in other contexts, providers, institutions, hospitals that identify with a particular religious tradition have been at the forefront of fighting efforts to provide care to LGBTQ folks and trans folks in particular.
We also found out Sanford doesn't have a corporate policy that addresses abortion, but a spokesperson says it will provide medically necessary abortions in accordance with applicable state and federal laws where they operate, and that its medical center in Fargo is nationally recognized for providing equitable care. But bigger doesn't always mean better.
Do you have concerns about a merger like this?
Well, I do.
Especially if you ask Alan Baumgarten, a healthcare market analyst who says a merger is mostly meant to gain more market power.
Your concerns don't sound at all like they might be thinking about making patient care better.
Well, the research on these mergers shows that for the most part, it leads to increased prices and is either indifferent or shows a slight decrease in patient care quality.
In fact, he says the move could raise your co-payments, deductibles, and premiums by as much as 10%. The merger, a move Sanford has tried before, once with Fairview 10 years ago, plus another 4 times with other health systems, including Allina.
Do you see this deal then even going through?
I would give better odds of Sanford and Fairview going through if the university hospital is in fact separated out from the deal.
The university says it's still negotiating whether it can buy back its medical facilities, while the Attorney General's office is reviewing this potential merger, saying that it will hold 3 more of those public hearings across the state yet this month. Jennifer Hoff, KARE 11 News.